All right, so now we're going to start in section 4. This is the cardiac arrest section. Section 4A specifically is resuscitation, CPR, adult and pediatric. Pretty short section, but there's a lot of important information in here that you may need to know when you take your test, hint, hint. So we're going to start up again in this left-hand corner, the circulatory support, It's the treatment priority box that we've talked about several times. So within the Oklahoma City system, or within the OMD system in Oklahoma City, we use the rescue CPR. It consists of the rescue pod and then the rescue pump. So if you've never used that before, you'll get to use that once we start doing some training here later on. It does work contrary to further belief. I can testify firsthand that I was not a big component when I first started working within the system, but the numbers do show that it does do a very good job, a much better job than just standard CPR. So when you're using the rescue CPR, the rate's going to be 80 per minute. If you're going to do standard CPR, the rate's going to be 110 per minute. Standard would be either before you get that rescue CPR on, or for whatever reason you're not able to use the rescue CPR. That first little bullet point I did not say out loud. It's apply the rescue CPR within 2 minutes. So just be sure that you do that. Again, 80 per minute for rescue CPR, 110 for standard. Appropriate compression, depth, and full recoil. That's pretty much just saying that when you're doing CPR, don't be going so fast that you're not allowing the chest to fully recoil. Think of the heart as a pump, and that you're trying to pump the blood throughout the whole body, get it to the brain, everything like that. So you've got to allow that chest to fully recoil so you can get the maximum amount of blood throughout the body that you need. Limit pauses and compressions, timely defibrillation if it's indicated, and then utilize the rescue pod. Anytime you're using the rescue pump, you have to use the rescue pod. You cannot use the rescue pump without the rescue pod. The rescue pod, we will show you how to do this later on when we start doing our mega codes and training and stuff like that. It just attaches right on top of the BVM. So just remember, you cannot use the rescue pump without the rescue pod. Number 2, oxygenation and ventilation support. Avoid hyperventilation and rate and volume. The BVMs, as Jake had mentioned earlier in the previous videos, they have way more air in them than what we are supposed to be giving to the patient. So you're not going to push on that bag like crazy. So make sure you're giving the right rate and volume. And then use waveform capnography if equipped. And we've mentioned this a couple times. We're going to continue to mention this just to make sure you guys know so you don't get in trouble. Anytime you intubate a patient, you have to use capnography. So if you intubate a patient, you have to have capnography on that patient. So you go down here, the EMR EMT box, position patient for effective resuscitation. Don't do CPR in a bed or anything like that. You want to move them to a floor on a flat solid surface. For adult non-traumatic cardiac arrest, chest compressions 80 a minute using rescue CPR. Again, 110 for hands only. Use the metronome, whether you use the metronome on the monitor or the metronome that we carry on top of the monitors, or if you're using hand heavy, it also has a metronome. It's a pretty cool little accessory, I guess you could call it. So use one of those and make sure you're doing the proper rate. Limit pauses on chest compressions. Avoid pauses whenever physically possible. You do not want to stop chest compressions. Chest compressions are singly the most important thing for cardiac arrest. Scrolling down, apply the AED or manual defibrillation pads if the paramedic is present. Place the pads anterior, posterior. So we're going to post the pads on the front and the back of the chest, anterior, posterior, right in the middle. We're not going to post the first set of pads on the sides, or like we used to do them. When a second ALS unit gets there, we'll post that second set of pads on the front. If cardiac arrest duration is estimated greater than 4 minutes and it does not have good quality bystander CPR, you'll perform CPR prior to AED rhythm analysis for defibrillation. So what this is saying is if you get on scene and there's no bystander CPR performed and they have been in cardiac arrest for longer than 4 minutes, or if it's unwitnessed, you're going to do 2 minutes of CPR before you're going to do a rhythm analysis. If the cardiac arrest duration is less than 4 minutes, then you're going to do immediate AED rhythm analysis for defibrillation determination. So you'll go ahead and check that rhythm and see what you need to do there. For adults, again, we talked about the compression rate. The ventilation rate is going to be 8 to 10 without pauses and compression. We talked about attaching the rescue pod to the BVM. For pediatrics, it's 15 to 2 compression to ventilation with 110 compressions per minute. The rescue pod is contraindicated if the patient is 12 years or below and the estimated weight is less than 50 kilograms. So do not use the rescue pod at 12 years and below and less than 50 kilograms. Follow the AED prompts for rhythm analysis and defibrillation if indicated. We don't use AHA anymore. We go to our own standard that's above AHA, but you can still look at those in here. We'll go over those here in just a little bit. After the AED shock, immediately resume CPR for 2 minutes. That's important to know. May or may not be a test question later on. You always immediately resume compressions after delivering defibrillation. If no AED shock is advised, obviously we're going to go right back to CPR for 2 more minutes. EMT or higher license only, place supraglottic airway if indicated. Only BVM ventilation is ineffective. If return of ROSC, refer to Protocol 4J. We'll hit that here in just a little bit. At 20 minutes of resuscitative measures, contact online medical control for termination of resuscitation consultation. So when you've worked a patient that is at home, not in a public setting. If it's in a public setting, we'll always transport that patient. If they are in a private residence, private area, and you have worked this patient for 20 minutes and they've remained in asystole the whole time, you've done everything you're supposed to do, you've controlled the airway, you've given medications, all the above, then you can contact online medical control. And when you do this, you need to make sure you have all your information. You need to have the history of the patient. You need to have how many epidoses you've given, your airway, your capnography, all the above. Make sure you have that ready because Dr. Goodlow, Dr. Knowles, whoever you talk to will want to know all of that. So just be sure you have that all ready. For advanced or intermediates, intubate after CPR is initiated. Your first attempt without pause and compressions, limit intubation compression pause to a maximum of 10 seconds. So do not wait longer than 10 seconds. For paramedics, assess for underlying etiology of cardiac arrest, treat per applicable protocols, rhythm analysis at next appropriate rhythm check, limit rhythm analysis compression pause to a maximum of 5 seconds. So you may see that later on as well. Just remember it's the maximum of 10 seconds for compressions, your pause in between compressions and your intubation. And then it's 5 seconds down here at the bottom when it talks about limiting rhythm analysis compression pause. And then that's pretty much it for that. It's just kind of the top water stuff, and then we will dive a little bit deeper as we get further along.